Hello there, welcome to ITV News Meridian.
Tonight's headlines in the south. Remembering Gaia, the family of a teenager who died on a Dorset hillside, talk of the missed opportunities to help her and their campaign for change.
Gaia was failed again and again by all the services she reached out to. It tore us up as a family to watch her suffer and fight the system.
Good evening. The family of Dorset teenager Gaia Pope are calling for improved services and support for those who report rape and sexual assault. Speaking after an inquest into her death, they say vital lessons must be learned.
The inquest ruled on Friday that Gaia probably died of hypothermia after disappearing in a distressed state. She went missing just over 2 weeks after being discharged from hospital without follow-up mental health care being put in place.
But the jury said other missed opportunities by mental health services and the police that were detailed in the 11-week hearing did not cause or contribute to Gaia's death.
The coroner has drawn up a list of recommendations to try to prevent similar deaths in the future. Christine Alsford has been speaking to Gaia's family about her story and their campaign for change.
From the moment she made an allegation of rape, her family say Gaia's life began to unravel. They told the inquest hearing that as her mental health deteriorated, the organisations that should have been there to help and support her let her down. Information not passed on, opportunities missed.
Gaia was failed again and again by all the services she reached out to. It tore us up as a family to watch her suffer and fight the system.
I can't believe really that we went through those 2 years as a family together, all trying so hard to get her rightful access to justice and rightful access to healthcare, and that it ended the way it did.
Gaia had a happy childhood, growing up with her twin sister Maya, older sister Clara and cousin Mayenna in the Purbeck Hills. But the inquest heard that after she disclosed the alleged rape, she was diagnosed with post-traumatic stress disorder, and that a decision by Dorset Police not to prosecute the man she had accused after a 5-month investigation left her devastated.
I was in the room when she got the phone call, and it's the light and the hope that she had, it went. It's this very bright human being going from shining brightly to her candle being snuffed out.
She wasn't able to go outside alone. She was scared to go to college. And she felt very unsafe.
After making the rape accusation, Gaia had a troubled 2 years with her health.
She wasn't listened to. It was under-resourced, and there were little to no specialist services for her.
Her severe and complex epilepsy worsened, and she received hospital care 4 times for her mental health. On the final occasion, just over 2 weeks before her death, she was discharged from Poole Hospital without follow-up mental health care, something the inquest decided was a possible factor in her death. What's your view of the level of mental health support that she received?
The tragic thing is Gaia didn't have anywhere near as much contact with mental health services as she should have. All she needed was that joined-up conversation, a care plan, and we as a family needed a crisis plan to follow.
Missed opportunities with her mental health is key. The care is not sufficient. It's not holistic enough.
Gaia disappeared in November 2017 in a distressed state, the last images of her captured on a shop's CCTV and a resident's doorbell camera. Her body was found after an 11-day search. The inquest jury ruled that she died of hypothermia. Her death was probably caused by her mental state and possibly complicated by her epilepsy.
This was always our worst nightmare. We knew that if Gaia didn't get appropriate support, that something terrible might happen.
The family, who have set up a campaign called Justice for Gaia since her death, say they now want changes including more training for those in public service around trauma and sexual assault. They're also launching a petition for a specialist unit to deal with rape and sexual offences within Dorset Police. They want other improvements too.
We need proper funding for mental health services and social support.
I don't want anybody to go through anything that we've been through ever. It's so painful and nobody deserves it.
We all miss her every minute of the day, and we always will. You know, I miss her laugh, I miss her courage and her kindness and her spirit.
Gaia died when we were 19, and I always imagined us as old ladies. So it's a waste because it's a life not lived. I've lost that time with Gaia, and she wasn't able to carry out her dreams.
Well, Christine is in our newsroom for us. What are the authorities saying about all this?
Well, Dorset Healthcare, the mental health trust involved in Gaia's care, has extended condolences to Gaia's family and is acknowledging more could have been done. Here's what the Chief Medical Director told us.
We always strive to provide the best possible care. We have listened very carefully to the coroner and jury's findings and accept that there were things that we could have done differently or better. We could have done more to help Gaia and ensure that she had the support that she needed. We have put things in place, a range of measures to address some of the issues, and we'll consider the coroner and jury's findings in much more detail to establish if we need to do more. We take these matters incredibly seriously, and no one wants anything like this to happen again.
Christine, there was another Dorset Health Trust involved in Gaia's care, the University Hospitals Dorset NHS Foundation Trust. What is it saying?
Well, its main focus was Gaia's epilepsy care, and it says UHD is continuing to work with regards to improving communications between acute and mental health. We are reassured by the opinion of the expert neurologist who was satisfied that Gaia's epilepsy care was appropriate. The Trust will consider the coroner's ruling in respect of the resourcing of epilepsy services, which has been highlighted on a local and national level. It's worth probably pointing out that one of the things that emerged during the inquest was that there were 2 specialist epilepsy nurses for 10,000 patients across Dorset.
And the police, what did they say about the bigger issues raised in your report?
Well, Dorset Police have told us that they are, and I quote, absolutely committed to supporting victims. They say the force is continuing to make improvements and that they're now ranked 26th in the country for positive outcomes linked to adult rape offences. That's out of 43 forces in England and Wales. Now, they told us, we take reports of rape offences extremely seriously and will do all we can to ensure offences are thoroughly investigated and offenders are brought to justice. We want victims to know that we are here for you. We would strongly encourage anyone who has been the victim of a sexual offence to come forward. They say all detectives in Dorset Police undergo specialist sexual offences training, and while they don't have a dedicated rape and sexual offences unit, they do have specially trained staff.
Christine, for now, thank you.